Hi, my name is Anthony Kataya. I'm here today to talk to you about Medicare supplements. What is a Medicare supplement? The Medicare supplement is that portion or that insurance that pays for those items that Medicare does not pay for. Medicare typically pays for about 80% of your Medicare or Medicare coverages. The supplement pays the other 20%. Now, there are different plans. You have Plan A, B, C, D, E, F, and G. H, I, and J will be eliminated for 2010, so we're going to limit our discussions to from A through G. The advantages of the plan primarily and is the fact that if you have Medicare, and again, Medicare pays about 80%, but there are also some deductibles. Medicare has deductibles if you go into the hospital. For the first 60 days, the deductible is $1,068. Well, a lot of people get confused by that. That actually could be much higher than that because it's in 60-day intervals. So in other words, if you go into the hospital and you come out of the hospital, and after 60 days you go back into the hospital, come out of the hospital, and after 60 days you go back into the hospital, and you kind of get the gist of this. It can happen to you 6 times a year. Now, in addition to that, from the 61st day to the 90th day, the cost is $257 a day as far as the deductible is concerned. From the 91st day to the 365th day, it's $534. Now, we're going to limit our discussions to the Plan F. The Plan F covers all of those deductibles. The $1,068 for each occurrence, the $257, the $534. So at the end of the day, you pay nothing. There is no copay and there is no deductible if you go into a hospital and you have a Plan F. Now, in addition to that, skilled nursing. Skilled nursing gets a little confusing. People think skilled nursing is really home health care or long-term care, and it is not. Skilled nursing is not home health care or long-term care. It's only if you go into rehab. And if you go into that rehab, you're going to pay nothing for the first 20 days. After the 20 days, from the 21st day to the 100th day, you're going to pay $135.50. That is the copay that you will pay if you go into a rehab. Now, if you have a Medicare supplement, you pay nothing. Again, the supplement will pay 100% of that $133.50. Now let's go to the next area as far as the doctors are concerned. Doctors, this gets a little more confusing. Now, when you go to the doctor, Medicare doesn't pay the first $135. You have to pay the $135. But if you have a Medicare supplement and an F plan, the supplement will pay the $135. Now, in addition to that, Medicare only pays 80% of the doctor coverage. You would have to pay the other 20%. So if a doctor charges $10,000, $20,000, $30,000, whatever it might be for the doctor, Medicare is going to cover 80%. And you would have to pay the other 20% for each occurrence. Okay, so it's not cumulative, it's per doctor per occurrence. So if you go into a hospital and you have several doctors taking care of you, you can wind up paying that other 20%. Now, if you have a Medicare supplement, you do not pay the $135 if you have the F plan, nor do you pay the 20%. Now, this is a little bit of a how can I say it, a little confusing when it comes to what they call excess charges. The excess charges are those doctors that do not take Medicare assignment. Now, what does that mean? That means that they can take Medicare, but they may not take the assignment from Medicare. That means they don't agree or not willing to take the amount of money that Medicare pays. They can charge 15% more. Now, could that amount to a significant amount of money? You bet, because again, it's on a per occurrence basis. Most of the Medicare supplement plans do not cover excess charges. The only two plans that cover excess charges are the F plan, which covers 100%, and the G plan, which covers 80%. So if you want more information on these plans and how they work and what the costs are, please give me a call at 1-800-70-HEALTH, 1-800-70-HEALTH, 1-800-704-3258, 1-800-704-3258, and I can be very happy to give you a quote for your particular area. It goes by area and age when you first come into Medicare. So it's very important to identify when you buy that supplement. Again, it's how old you are and also the fact of what your zip code is.